It wasn't long ago when we used to see long lineups of people outside places like the Earl Bales Community Center looking to get their COVID vaccinations. Now, though, those scenes are well behind us, despite public health officials continuing to urge people to get more shots.
We know COVID's still out there. We know we're expected to see a rise in COVID cases in the fall or winter sometime. There's also competing viruses as well. We're going to have a flu season this year that's very likely. And then you take a step back and you look at our healthcare system is already pretty stretched.
Despite recent debate over whether the pandemic is actually over, medical professionals are quick to tell everyone there's still reason to stay safe. With that, the bivalent booster will be available to Ontarians 18 years and older as of Monday, a new vaccine developed to fight the Omicron variant.
In general, it's a really good idea to get this booster vaccine, especially for people over the age of 60 or for people who have medical conditions that put them at greater risk for severe infection.
Before now, the boosters were only accessible to those 70 and older, residents of long-term care and retirement homes, Indigenous people, and those who are immunocompromised. Others could start booking appointments for the bivalent shots 2 weeks ago, but the need to do so now doesn't seem to be as urgent as it was.
We're fully vaccinated, both of us, so we'll probably will do the booster shot anytime soon, so probably not. Why not?
I got 3 shots for COVID. I don't know about the new thing. I think it's enough.
I got mine back in May, the end of May, and I'm going to get mine again in November. 6 months, every 6 months I get it.
Health officials continue to emphasize the importance of preventing severe sickness and hospitalization as a result of the virus, but recognize that COVID fatigue set in a while ago.
If we look at vaccine uptake in Ontario, in most age groups, we actually see a pretty sluggish vaccine uptake, be it primary doses in younger cohorts, be it booster doses in some of the older cohorts.
Toronto Public Health currently has spaces set aside for vaccination clinics in community centres, even malls, but with next to no signage and no one other than staff inside when CityNews stopped by.
At that time, there were heroic efforts to get vaccine to the people. We saw, for example, 24-hour vaccine clinics. We saw pop-up vaccine clinics in harder hit neighborhoods. We saw vaccine clinics in houses of worship and in community centers, very strategically located.
Also, as of tomorrow, the pediatric Pfizer shot is available for children between the ages of 6 months and up to 5 years old. Parents can use the same provincial booking system to schedule an appointment. Mark McAllister, City News.